How can physicians master telehealth for great remote patient care? Learn how on this week's Medical Economics Pulse.
During this period of social distancing where you're trying to minimize the number of patients coming into your office, I think the best thing is to sit down with your office staff, look at your existing workflow, and plot out the natural transition points where you swap out in-person care for telemedicine care. You may want to cluster chunks of time for your telemedicine visits. So you the physician, will sit at your desktop or whichever other device you're using and just go through a whole batch of visits back to back using this modality.
As physicians deal with financial struggles from the COVID-19 pandemic, telehealth is serving as a lifeline. Virtual visits are allowing physicians to treat their patients and retain a revenue stream during these difficult times. But getting started with telehealth can be a daunting challenge. Today, we are joined by Dr. Tabassum Salam, the Vice President of Medical Education at the American College of Physicians. She's going to discuss how physicians can get started with telehealth. Dr. Salam, thanks very much for joining us today.
It's a pleasure. Thank you for the invitation.
Thanks. So the first thing is, can you talk a little bit about some of the misconceptions of telehealth? Obviously, a lot of physicians are embracing it, but I think there's some out there that maybe are a little more hesitant. Can you talk a little bit about some of the myths that are out there and how, and maybe some of the truth behind the myth?
I thank you for that question. I think the first biggest one to deal with is a concern that maybe patients don't want to access care through this medium. We're learning not only in this state of the national health emergency, but in general, that more and more patients are eager to embrace this methodology of reaching out to their healthcare providers. It just extends access so much more, not just because of geographic barriers and the inconvenience of traveling to an office for your healthcare, but now with social and medical distancing, which has become a necessity, this is a fantastic way to make sure that as a patient, you're able to stay connected with your physician. And certainly as a physician, it's so reassuring to know that you can check in with your patients, especially those with ongoing chronic diseases that need interim care, and that shouldn't be delayed. I know another concern for many of us has been that we won't be able to offer healthcare across the board in an equitable manner to every last patient. And that, unfortunately, that is true. There are still large pockets of our nation where broadband access is limited or non-existent, and it's difficult for those patients to utilize video conferencing through telemedicine. It needs to be addressed. But at least until that happens, for those who are able to access their healthcare providers using this modality, we should offer it to them. Another concern is about certain subgroups of patients unable to use the technology, even if they have broadband access, for example. I commonly hear, well, quote, my older patient might not be able to do this, end quote. And I personally can tell you I've been so pleasantly surprised by the fact that patients of every age group are jumping in and making do, and they're doing really well. Video conferencing has become so commonplace, especially in the last month or so as we're socially distancing. Grandparents are checking in with grandkids. People of every age group are doing so for social and work reasons. So many of those barriers are going away. There is always the good old-fashioned telephone, but there's so much more value in being able to see your patient and having your patient see you. It's wonderful to push for it whenever possible.
Great. Can you talk a little bit about I know it's sort of an opportunity now with the pandemic to reach out to your patient to communicate that telehealth is available. But can you provide some tips for how do you actually, reach out in a way that's clear, that is sort of you want to promote that you have this with your patient, it's available. What are some kind of tips for sort of communicating and marketing this to your patients?
Absolutely important to get the word out that, first of all, your practice is open and you're available to take care of them, and that now you have telemedicine available as well as a new medium with which to check in. So I think the first thing will be to make sure that you, your office staff, your co-physicians, and other healthcare providers in the practice all know that you're doing this and everyone's on board. Sit down with your receptionist, nurses, and other staff that interact with your patients, usually by telephone. Make sure that perhaps you should write a script for them that outlines the fact that you have made the conversion to telemedicine, the advantages, and with a reassuring message to patients that you will be there to help them make the transition and to help them troubleshoot with some of the technical difficulties if they feel they have them. Maybe you should get out your scheduling calendar for the next month or two and look at all the appointments that had been scheduled. Usually follow-ups is scheduled a few months in advance, and reach out to each and every one of those patients to tell them that they shouldn't assume that the appointment is canceled, that it's going forward, and invite those patients to make the transition to your telemedicine platform. If you have a website, make sure you make it very clear there that you have made the transition. If you have a patient portal, likewise, put a message there. And if your practice is one that uses social media to stay in touch for general messaging with its patients, obviously, put an update there as well.
Okay, great. So obviously workflow is very important in a practice, and I kind of have a two-part question. The first part is, how do you build a telemedicine workflow that works right now during the pandemic? And then once we're transitioning into seeing more patients in person, how do you sort of integrate your workflow so you're doing all telemedicine for the most part now, but then you're going to go back to seeing patients in the exam room while also trying to do telemedicine? And so what are some tips for sort of building that workflow initially, and also sort of then like braiding it together so that you have, something that works efficiently so you can see your in-person patients and your telemedicine patients?
So let's take the first part first, which is right now during this period of social distancing where you're trying to minimize the number of patients coming into your office. I think the best thing is to sit down with your office staff, look at your existing workflow, and plot out the natural transition points where you swap out in-person care for telemedicine care. You may want to cluster chunks of time for your telemedicine visits. So you the physician, will sit at your desktop or whichever other device you're using and just go through a whole batch of visits back to back using this modality. And then maybe just save a chunk of time for the inpatient care that you feel is necessary, those patients who have to come in. And that's not a bad model to retain for the period down the road when social distancing hopefully ends, and hopefully not at a safe time in the future. Many of my physician colleagues tell me that is what is most efficient for them. There are others who are very comfortable making the jump literally up and down from their desk into a patient room to see an in-person patient visit, and then pop back into their quiet office space where they take the next case by telemedicine. And so I think that part needs to be investigated by each physician and healthcare provider in your office. Either one is feasible. Sometimes some of my physician colleagues tell me they have a sort of virtual waiting room for urgent care visits by telemedicine. And during a lull in between patients that they're seeing in the office in person, they pop over and do take care of that urgent care visit, and then turn that off and go back into the next patient room.
Okay. Obviously, one of the things that primary care practices especially are really focusing on team-based care and making sure that every clinician in a practice is working at the top of their license, all those types of things. How do you sort of do that via telehealth? I imagine it's relatively similar, but I'm wondering, as a practice, how do you kind of work through, making sure that the various clinicians are seeing the appropriate levels of patients so that your practice is working efficiently?
I think many of the current methods that practices use to determine how to share the burden of care between the various different healthcare providers, that doesn't really change. But if you integrate telemedicine into your workflow, I think it gives the practice so much more flexibility and capacity to extend the care from their professionals of every discipline to various patients. For example, if you've got a practice with multiple different locations, but you've got one nutritionist to be, quote, shared across the different locations, and hence to be shared with your collected patient pool. How fantastic it is to use telemedicine to raise the efficiency of this person rather than having the nutritionist travel from office to office, or chunk her time, perhaps, dedicating Monday to practice location A and Tuesday to location B, which can be inconvenient for patients to drive to. He or she can work from one location, maybe even her home, and be available to all your patients, regardless of where your patient is located. I think it's going to only enhance the use and interaction and efficiency of use of the skill set from your colleagues of every discipline.
Okay. Obviously, video conferencing is going to be new to some physicians. I'm wondering what advice and sort of tips you have for physicians to practice sort of this interaction on video, because it's one thing to sit in an exam room and talk to someone. Sometimes it's different when you're on camera and those kinds of things. Can you talk a little bit about how physicians can feel more comfortable doing a telehealth visit with their patients?
Absolutely. Most of us, many of us in practice today, weren't trained on this. And we received a lot of training about in-person care, building rapport with your patient, eye contact. All of that's important. And the good news is so much of that, if not all of it, can be transitioned to telemedicine. So the first thing you want to do is make yourself very comfortable with the screen, the setup of your equipment, where your webcam is located, and remember that your patient's watching you, and as well as you watching them. Take a quick look at the room from which you're conducting your visits. Choose one that's hopefully uncluttered, maybe with a very simple wall behind you. If you don't want the patients to see your personal effects like family photos, then make sure they're not in view. Make sure your room is well lit, and concurrently ask your patient to sit in a well lit location, because you want to be able to have a good view of them. Make sure your room from which you're conducting the visit is quiet, preferably with a door that you can close, because you want to ensure privacy. And remember, you will probably have more than one screen up. One screen through which you're interacting with the patient, and perhaps another one where your electronic health record is. And just tell the patient that you will be looking back and forth between the two screens. That way they're not surprised or wondering why perhaps you're looking away. And remember that you will need to guide the patient as well, at least the first couple of times, so that you can see them and see the various parts of their body, perhaps, that you want to examine clearly.
Yeah, that was actually my next question is, can you talk a little bit about some of the mechanics of conducting an exam via telehealth that are, like what advice do you have for conducting a basic exam via telehealth?
Absolutely. So the biggest thing is you can gain so much from the mere visualization that telemedicine gives you. You're looking at your patient, you're observing them. We're trained to watch the ease with which a patient speaks to us, because if they're appearing to be short of breath, that can be a concerning factor. We can see a lot. You might want to ask the patient to stand up, bear weight, and walk. We can glean a lot from their gait. You will want, for example, if you need to examine a rash or a skin lesion, to ask the patient to move their camera closer to that area of the body. And if you want to get an idea of the size of a skin lesion, for example, ask the patient if they have a small ruler handy to hold up next to the lesion, so you can get a sense of how many centimeters long it might be. And even if they don't have a ruler, ask them to put a dime or a nickel next to it, so you can use that as a frame of reference. You can ask the patient to press on certain concerning areas of the body, perhaps if they have swollen ankles. So they can perform parts of the physical exam for you on themselves. And one of the biggest concerns that I hear raised by my physician colleagues is, well, I can't use my stethoscope. And that's true. But there are many proxy measures of heart and lung health that we can use. Shortness of breath can be seen in the way a patient is just interacting with you, just sitting there. So you can use many of those alternative measures. And there are some other things that patients can actually conduct themselves that are often done in the office. If they have a weighing scale, they can weigh themselves and tell you their weight. If they have a home thermometer, they can read off their temperature. If they use a glucometer to test their blood glucose, they can do so during the visit and tell you their current blood glucose level. And believe me, if a patient is in such an extreme state that as a physician, I'm extremely concerned about their state, I will just say, I'm so sorry, you're looking sicker than I had hoped, and I'm concerned about you. Let's cut this telemedicine visit short and make plans for you to come in to be seen in person.
Okay, great. So how do we evaluate, what is a successful telemedicine visit versus one that maybe had room for improvement? What's the role of surveying patients? I guess what I'm asking is, can you sort of explain how you sort of evaluate, make adjustments, so that program of improvement, you're starting from scratch and you want to build something that's sustainable and something that's effective and that your patients appreciate. So can you talk a little bit about how you sort of make that cycle of kind of improvement and success and how that works?
I think at a very minimum, as you are concluding your first visit with a patient, ask them, quite frankly, what worked for them and what didn't. They'll tell you, and incorporate their suggestions into the next series of visits with them. Perhaps, a couple of days after your first telemedicine visit with a patient, you could ask one of your office staff to call that patient by telephone and just take a quick 3-question survey. And the simplest measure of success will be, I think, if a patient agrees to do it again. And again and again, especially then as you watch your volume of visits shifting from in-person to the video conferencing mode. That in itself will speak to the success of the program.
Okay, great. Is there anything else in terms of building a telemedicine program that you think it's important for physicians to know right now?
It's an important time. There are several easing of regulations happening right now, relaxation of regulations with respect to licensure, HIPAA, stringent HIPAA compliance of the telemedicine platform you're using, types of patients that you can reach out to through telemedicine, patient location restrictions have been eased, and reimbursement has been broadened. And so now, during this public health emergency, is a great time for physicians to take the leap, test things out, get comfortable with this methodology, bring your patients into the fold, help them get comfortable with this platform, and build the ease and skill set into your own practice, and certainly get your staff ready and primed to make telemedicine a more standard part of your clinical care offering.
Great. Dr. Salam, thank you very much for joining us today.
My pleasure. Thank you so much for the invitation.